On behalf of the management and staffers of LiveWell Initiative, LWI, we want to welcome you to the Real Estate and Property Day session for the Grand Health Bazaar 2013.
With that opening remark, the second day of the health workshop is declared open. The general health status of the people is the reason for this bazaar, hence the need to visit the issue of incessant building collapse, deficits in housing, and numbers of slums in the country. According to these experts, there is the need to drive standards through partnerships and proper regulation to eliminate compromises in building safety.
You find people who are not supposed to be builders building, people who shouldn't be bending steel. And when you have all this together, the potential of that building collapsing is there because you have not met the requirements or the standards. So if we use the right people, if we engage a builder and we know this person can build, we've seen what he's done before, then the chances are that he probably will build properly.
Can we transfer the risk of losses in the real estate business, wherein if I'm taking your risk of a loss, then I will take the responsibility to ensure you meet the standards that has been laid down. I think what is missing in our economy is that we're not creating sufficient partnerships to drive standards. We'll leave it for the regulator. Once you leave anything for a regulator, you leave the room for compromise with the regulator.
Chairman of the event says deficits in housing in the country will continue to be a health hazard if not checked now.
If you have an average of about 4 people staying in a house, it means you have easily some 70-something million people today who are not living well. It means that when you look at the slums in our country, they cannot be living well. Are we then surprised that it's getting difficult to eradicate poverty, to eradicate polio? Because if you are not in numbered houses, it's difficult to even ensure coverage.
Representative of the Minister of Health, Mozambique, expresses optimism in learning from the Nigerian example to solve the health risk in property in Mozambique.
Normally, our infrastructure doesn't last longer. Sometimes when we are launching a new health center, we have problems. I'm waiting to listen all the experiences and see how can I take the experience from Nigeria to improve the quality of infrastructure in Mozambique.
While government seeks to resolve housing deficits in the country, it is hoped that precautionary measures are taken to ensure the safety of inhabitants of these buildings. Adesua, Omoruan.